Welcome back to our Believe in the IMG series. So, what we're going to talk about today is how do you overcome challenges like communication when it comes to the USMLE journey. So, let's find out. We interviewed one of our students, Dr. Jinwook Park, who's from Seoul, Korea. He walks us through his journey on how he overcame some of the issues that he faced, communication issues, lack of USCE, differences in the Korean and the US medical culture. Good morning, good evening, everyone. Today we have a special guest, our student, Dr. Jinwook Park, and he overcame a lot of challenges in his residency journey. So we want to talk to him about the challenges and how he overcame, and what are some of his suggestions for other students. So, welcome, Jinwook. How are you?
Yeah, I'm good. Thank you. Thank you for inviting me here.
Thank you. Now, we want to start off with your introduction. So, do you want to give some background of where you're coming from, what kind of experience you had in the home country, etc.?
Okay, I'm a South Korean doctor and have 1.5 year clinical experience in my alma mater hospital and worked in army for 3 years. In South Korea, we have to go to army, and I'm aspired to become a doctor in the U.S. and I prepared while I was working in the army. And and for your reference, I graduated my medical school in year 2012.
Then, you graduated in 2012. There are a lot of differences between the South Korean medical culture and the US culture, and, the social culture and languages. So, what were the challenges you faced when you were preparing for USMLE, or were you here? What were the various challenges you faced?
And absolutely, it was English.
Okay.
And and for me, USMLE score was challenge. And first, I didn't expect that it was so competitive like this. So
Okay.
I didn't really work hard on my step one. I think I little underestimated everything. So my step one score was 226, and so so it was a huge challenge, and I wasn't able to uh, apply to some of programs where they have cut off over 230 or 235, and it was so frustrating. So I definitely recommend all of you to prepare USMLE steps very thoroughly.
Okay, so you said, the scores and English. Now, what about US rotations? Was that a challenge?
Actually, it was challenge first, and clinical environment in the US and Korea is so different, and so that's why I failed at my CS exam once because it was so different, and then I prepared my second CS exam very thoroughly, and it was a huge help. And after passing CS exam, after preparing thoroughly, and it helped me assimilate to a U.S. clinical environment. So, and
And
I think that CS exam is really good exam. And sometimes while I watch patients in US real US hospital, sometimes
mhm.
I think that it really looks like CS exam. And
Okay,
CS exam.
okay. And And what about the US rotations? How different were they from what you have in Korea? The rotations, the actual, the 1 month or 2 month rotations you did?
Uh, I was an observer in the US, and so I have to come up with questions, and I have to try to participate in conversations, and if I don't do that, I'm just the odd man out. So yeah,
Okay.
yeah.
Okay.
and and actually I learned a lot about US hospital and how they treat patients and how they work on patients' notes and how they communicate with uh, American patients, and I could get the hang of what's going on in the US hospital, and that was very informative, especially during interview.
Okay. So now let's talk about your interview experience. How was the interview experience? What type of questions and how prepared were you for the interviews?
And they ask classic questions. They ask classic questions like, "What is your weakness? What is your strength? And tell me about yourself," which we all prepared together. And so, and when I got that question, I just spoke what I prepared. And other than that, it's a conversation between human. I'm not talking to a robot,
Right.
and so and it looks like more of conversation than interview. So I think that interview is talking to the interviewer. It's not
Yes.
an exam. It's less of exam, more of a conversation.
Yes. Yes. So then, there are other similar students who may be applying this year. What suggestions do you have if they are facing similar challenges? They may not know the US system, they may have challenges with communication. So, what recommendations do you have?
First, you need to experience American clinical environment a lot. So observership, and there are observership, and there are also externship, where you
Yes,
can have more chance. And so and and I think that you have strength, and so I have some red flags. I have some weaknesses, but I also have some strengths.
right,
And so my step to CS my step to CK score was good, and I had clinical experience in my home country, and that was also my strength. And so if I had no clinical experiences, if I had no good score in CK exam, I wouldn't have made it.
finally, how was our team helpful to you? The PS, the CV, interview prep, the closed WhatsApp group. Did you find all that useful?
Very useful. And uh, exactly 1 year ago, I had no idea about what is matching. I had a pretty good idea of what is USMLE exams, but I had no idea about matching and what is token, what is LOR, what is ERAS. I have no idea, and I just joined your team, and you spoon fed me, and you provided every essential information, and so it helped me with preparing application documents, and provided me with uh, interview questions, and provided feedback, and And WhatsApp chat room was my major information source. And mock interview, I was able to come up with my answers because of your mock interview sessions. And I had tell me about yourself. It's very tricky question, and I had no idea, but I was able to make my answer because of you. Um, it was really helpful. I really recommend anyone joining your team.
Thank you. I appreciate it. And any last minute suggestions for applicants who may be applying this year?
Um, I think that huge part of matching is uncertainty. So
Yes.
uncertainty is really sometimes painful and sometimes makes you nervous and anxious. But forget about the result and focus on the process and completing tasks right in front of you completely perfectly will make you successful.
Thank you very much, Junwook. Appreciate your time.
Thank you for inviting me, and thank you for your help. I
Absolutely.
really appreciate it.
Thank you.